Hey gang, ever seen one of these before? It's a grip strength thing. You might have done it here, you might have done it in another office. What it does, it measures your grip strength. So what we do is you hold this thing out, you squeeze, and then you relax, you squeeze, and you relax, and you go, hey, what's the number? Pounds, kilograms, whatever. So what does it mean? Well, here's the simplicity of it, is it should be, relatively balanced side to side. Maybe your dominant hand, which in my case would be my right, would be, 5, 10, 15 pounds heavier, but relatively balanced side to side. In gentlemen, it's going to be around 100 pounds, and gals, it's going to be around 60 to 70 pounds. That's not calling anybody weak. I'm just telling you the statistics that are out there. Why is this important? Because when we do this, we kind of have this grip strength thing. Well, what happens is if you and I do this and we put our hands together, we pull apart and really just pull. That's usually about 50 to 60 pounds of force that we're doing that. When we just pull. When you do that, you're going to feel muscles, tendons, ligaments all around working, firing. You're even going to feel your butt tighten up a little bit, because of the stability of doing this as well too. Why is that important? Because it answers the question of why do we check children, even babies, in this office? Because what they have found is that when a baby is born, what does the doctor do? Grabs onto the head and neck and pulls the baby out of the birth canal. What do they do? Well, this research tells us they use 60 to 90 pounds of force. 60 to 90 pounds of force. Why is this important to you and I? What is the weakest part of a baby? As soon as you get held a newborn baby, what does everybody say? Watch the head. Why? Because the neck muscles are not developed yet. They are basically going to do this and let go wherever gravity takes them if you do not support the head and neck. So this is the weakest part of a baby, and what do? We do this even more to the head and neck of that baby, pull and often twist. Right there can be the very first misalignment, the very first problem for a baby. And that's why it is our job to check and see how that baby is doing to make sure the alignment is good. Picture a tree that is a little sapling that is growing crooked. What happens when that sapling grows up 10, 20, 30 years? It's really crooked, and there ain't no fixing it at that point. But if you take that same tree that starts to grow crooked and you put those bands on it to straighten it up, to support it, then we now have a tree that grows straight. So that's what we're talking about here. Focus on that, try that, feel that, recognize that's what our babies are getting. More importantly, recognize that chiropractors can actually find those misalignments, fix them, and get that baby heading in the right direction, reaching their greatest health potential. Until next time, enjoy your Myers Health Minute. Take care.